So let me ask you something really quick. So like when you're doing a workup like that, like I'm assuming you put me on a treadmill and like an oxygen mask and I just sprint as hard as I can until I'm like, yo, I'm gonna throw out. I'm gonna pass out. um, is there like are you looking at that and saying, okay, well, now this is the aerobic program we're going to put you on, and like is there breathing techniques, is there, you know what I mean, like is there all
Yeah, so it all depends on how in depth people want to get. Most clients don't want to get into that depth, but if they do want to get into that depth, then yeah, we can definitely hook you up with the right fitness coach to kind of guide you through that.
okay,
Yeah.
that's crazy.
So that how you measure the what is it called? The
VO2
oxygen
max.
intake? VO2 max?
Yeah.
Yeah. So how exactly do you measure it at your clinic?
So on a treadmill.
That you
So
do
we
the
basically
treadmill,
get you on
okay.
a treadmill, and then we basically gonna get it steeping faster until you drop.
Okay. And then you can measure the levels.
Yeah.
Interesting.
Dude,
It's cool.
yeah, it's really
stuff.
cool. And I think like for me too, like I'm excited about the challenge of it to be like, okay, like how far can you really push it,
Yes.
you know?
Well, it's cool, yeah, because you're gonna go in, you're gonna
Yeah.
have certain levels for everything. Once
Yeah.
you see those levels, you're gonna want to blow them out the water.
Yeah, 100%.
And then we'll tell you.
Yeah.
Like we'll tell you based on normative data for your age and gender, where are you? Are you at the mid-level, like 50th percentile? Are you at 80th percentile? Are you like where you are? We can actually determine that and tell you, your fitness level at the population level for anybody at your age, other men at your age, where are you in that spectrum?
And now, so we have the 4 different pillars, right? I think you had sleep, mental health, exercise, and diet, right?
Mm-hmm.
So are you checking all 4 of those and saying, okay, out of 100%, you are here, here, and here for your age?
Absolutely. Yeah. So that's basically what we do. So we basically tell you, I mean, there's a lot of metrics to measure on both, on all 4 of them. But yeah, we give you a pretty good idea of where you are, how well it's controlled, how well it's optimized in all 4 of those areas.
Wow. Dude. Shut it down and do it right now. That's crazy.
So how long does this process take for you to complete measuring everything?
Yeah, so you essentially first come in and we basically do a full intake. So we take a kind of a full history physical, kind of understanding your body, understanding your medical history very, very well. Now on that same visit, we do all of your blood work panel, and we'll also get you on the treadmill. So we'll kind of get your VO2 max, your aerobic capacity on that visit. And then you have a visit with our fitness coach. So we go through all of your exercise metrics. So we get a pretty good idea of that. So we got a whole report for that. Then you have a dietary assessment. And then you have all of your imaging, your cardiac testing. So that typically includes an ultrasound of your heart to kind of look at comprehensive assessment of the structure of your heart, the function of the valves, pumping function of the valve. We typically get what we call carotid ultrasound in our patients. So basically looking at vascular buildup in the arteries of your neck, which is a predictor of your risk of stroke. In certain patients, we also look. Yeah. So I mean, we kind of look a very good look at your vasculature. Do you have any plaque? Are you at risk of heart attack or stroke? And what's the pumping structure of your heart looks like at baseline?
Mm-hmm.
And then we also do your body composition analysis. And then your sleep test is at home. So you can basically, we'll kind of give you the kit. You take it home. You'll put it on one night. We just need one night, a typical night worth of data. And then we fully analyze it to look at your sleep architecture. So not only looking for things like sleep apnea, but also getting a pretty good idea of your sleep efficiency, how much REM sleep you're getting, how much deep sleep you're getting. And then you meet with our sleep specialist to go through your sleep results and give you some very practical tips to improve your sleep, because sleep is also massive, right? It affects all of these pillars.
I'm going to check mine. Sorry, continue.
Yeah. So and then that whole process, so basically from the beginning to end, it usually takes about 4 to 6 weeks.
Okay.
And then your final visit is with me, and then we go through everything and kind of come up with a plan. Like this is where you are.
Like it's like a month and a half long process.
Yeah. So you have like multiple stops to kind of get everything done.
So 1 week you meet with the dietitian, and like every week you meet with one person.
Exactly.
The 4 pillars, and then 5th week they're meeting with you.
Exactly.
Okay, Ben. So I have 7 hours and 43 minutes of sleep.
Not bad.
82% efficiency. 78. It says my sleep score is good. Restfulness is red.
What's your REM and deep? You can actually look at that data in there too.
34%.
34% REM?
Yeah.
Oh, that's pretty good.
Oh yeah, brother.
How about you? How about your deep?
21.
Oh, that's very good.
I had a good sleep last night.
Yeah, that's like a particularly good sleep. I don't think you get those numbers every
He was
night.
in a coma.
Let me tell you.
Yeah, this is like, but yeah, like what are your averages? What's your 30-day averages there? Can you get those?
I think so.
It's all public information now.
Because those numbers are very good. Like if you get that kind of sleep every night, you're gonna live like 20 years younger, bro.
Well, yesterday, so I had 78 efficiency, 7 hours, hour 46 REM, hour 40 deep, and then I don't even want to tell you. I don't even want to tell you that one. I have 3 hours of sleep that night.
Oh boy, there you go.
28 minutes of REM, hour and 2 of deep. Hell yeah.
So that's not bad. Yeah. So I mean, I usually tell people, yeah, like you
I'm
need.
pretty like though, like I don't know, like other than the weekends, like I'm
You're really good at sleeping, man.
I'm really good at sleeping.
Yeah, that's awesome.
Fuck's sake.
That's good. And sleep is so important, right? And your sleep actually kind of deteriorates as you get older. So it becomes like I don't sleep. Like I have to put so much more effort into my sleep now that I did in my 30s. And that's like a very natural process. As you get older, it becomes a lot harder to sleep very well because we kind of, our phases of sleep and our circadian rhythm changes quite a bit with age. And that's why it becomes so much more important as you get older. And it's much more important also for regenerative reasons. So for things like memory and concentration, because again, those things deteriorate as you get older.
Yeah.
So your sleep becomes even more important for your performance as you get older.
So when you say you got to basically try harder to sleep, like what does that entail for you? And I guess people at that age, like is it like using not drugs like Xanax, but like what's the other one? Everyone.
Trazodone?
No. It's you can get it over the counter. Melatonin.
Oh, melatonin.
Yeah, like it's stuff Xannies. No, but like you know what I mean. Like is it
Yeah.
stuff like that? Is it like
No.
more exercise?